Chapter 26, Fluid and Electrolytes. How do we treat it? What are the nursing implications? Assess everything. Assess baseline electrolytes. Assess vital signs, I&O, mucous membranes, daily weights. Weights is one of the best ways to figure out what's their fluid balance. What's happening with their fluid status. Before giving potassium, check their heart rate. Check the EKG. Let's make sure their heart's doing okay before we start giving this stuff, which is going to influence the heart's function. Assess for contraindications, assess transfusion history. If we're talking about giving blood, you want to know, did they have a reaction last time they got a blood transfusion? Make sure they've got venous access if they need it. We're going to look at their serum levels, their lab levels, before, during, and after therapy. We're going to watch the IV. We're going to make sure we're not infiltrating. We need to, if they're getting potassium by IV, we need to watch that closely. The rate should not exceed more than 20 milliequivalents per hour. The body just can't handle it. Remember, this drug, it's an electrolyte, but in this case it's a drug, affects the heart functioning. You give it too fast, you got a problem with the heart. Never give an IV bolus, and never give it undiluted. If we give it orally, you have to dilute it in water or fruit juice to minimize the problems with the GI tract. And we're going to watch for signs of GI upset. Give colloids slowly. Remember, colloids are going to pull fluid into the blood vessels. So we need to be watching for fluid overload and possible heart failure. Have we put so much fluid between the IV solution and the stuff that's getting pulled from the tissues into the vessel? Have we overloaded their vascular system so the heart can't handle it anymore? For blood products, there's always guidelines. There's always administrative procedures. Make sure you follow them closely. And they usually mean two people have to be checking to make sure you're hanging the right thing on the right person. All that. But we're going to monitor closely for signs of reaction. All of these things, whether it's a colloid, a blood product, a crystalloid, an electrolyte, we're going to be watching lab values, and we're going to look, have we improved their fluid status? Have we improved their electrolyte status? Have we improved their ability to tolerate activities? And we're going to watch for adverse effects.